Hey, good morning, everybody. Happy Sunday. This is the Pain Free Performance Podcast. I'm Pete Inserillo, student physical therapist, strength and conditioning specialist, here with my good friend Drew Coben and our first ever, client testimonial, Sean Crom. What's up, fellas? How we doing?
Doing well. Thanks for having me.
Anytime. Drew, how are you today?
Doing awesome. Got my workout in. Ready to talk shop.
Awesome. I love it. All right. So Sean, Sean's been a good friend of mine for the past year and a half, 2 years now. And we started working together when, Sean? Back in September?
Yeah, just September. About September, October.
So Sean, tell the audience a little bit about your sports background, kind of how you grew up playing sports and the highest level that you competed at, and then talk to us a little bit about the injury that you accrued.
Yeah, so I grew up, big family, 9 brothers, 2 sisters. Everything was always super competitive in my house. We were literally fighting over like the last Pop-Tart in the house, all that. So everything was just competitive, every step of the way growing up. I played multiple sports growing up. I played football, I played baseball, I ran track, I did a couple different things. Same with my older brothers, but I was the only one that was very injury prone. I'd get hurt, quite a bit. I've had ups and downs with injuries. The one specifically that, we're referring to, on this episode is torn meniscus, flap tear in my knee. I tore that playing basketball. I remember it like it was yesterday. I knew that there was something wrong. I went and got it checked out. They mentioned that it was the flap tear, and they told me, listen, like surgery is, always an option, but with this type of injury, we recommend not getting the surgery because the flap tear, will come in and out, get stuck inside, the knee every now and then, but you could live with it. But got to the point where I really couldn't live with it. I'm in the car all day for work and just sitting in the car all day, that it would really just lock up and, cause a lot of pain, and it was preventing me from doing the things I loved. So that's when I, reached out to you and asked you to help me out, and kind of rehab this thing and, build strength around it to make sure that this type of stuff doesn't happen anymore.
Yeah. So, I guess first let's talk about a little bit what the meniscus does, its job, its role in our bodies. And Sean, I'm going to have you describe in just a second, like the exact mechanism of how that happens. So, our meniscus is considered the shock absorber of our knee. It's sits in between the distal femoral head and the tibial plateau. There is a medial and lateral horn, and there are different layers to the meniscus that has good blood supply, is perfused fairly well, and then there's portions that are avascular, therefore they don't have blood supply. They're not able to heal as well as the other part. So Sean, do you know if there was a medial or lateral meniscal tear?
Medial.
So fortunately for you, that is the horn that does have better blood flow. However, there's the outer portion, the middle portion, the inner portion. As you could probably imagine, the outer portion, the middle portion have better methods of getting blood flow than the full inner portion does. So Sean had a flap tear, meaning that there was a tear in which, as you could probably picture, it flaps, and it can cause a locking of the knee. So, range of motion is not always promised, and it could be very painful. Amongst other tears of the meniscus, there's longitudinal tears, where if you can imagine like a crescent-shaped moon, the tear goes along the convex surface or the outer surface of the moon. There's a transverse tear where it kind of cuts straight across. There's obviously the flap tear. There's the bucket handle tear, which is kind of on the inner or concave surface of the crescent-shaped moon. And then there's a torn horn where, if you can imagine, one part of the horn is just completely torn. So, Sean, talk to us a little bit about the exact mechanism and how that specifically happened.
So I was playing basketball, just a pickup game, went up for a rebound, standard, just like I always do. And then I came down on it, and my knee kind of twisted the wrong way as I came down. I actually hit the floor. you know, there was a grouping of, you know, people under the rim going for the same board. We all came down. As I came down, my knee kind of jammed into the ground, locked up and twisted, and I came down to the floor. I got up and continued to play on it because, as you know, your adrenaline as an athlete, you know, you just get up, you know, you could literally be,
knowing you.
yeah, you could literally, you know, chop my leg off and I'm going to still try and play. But, yeah, I mean, it wasn't until, you know, a couple days after where I realized that there was something, you know, actually wrong with it. You know, very similar, you know, you watch, you know, even guys playing in the NBA today, you know, when they go up for a rebound and their knees, almost like a non-contact, you know, kind of thing. So, you know, that's essentially, you know, what happened, you know, when you explain, you know, the mechanism of, you know, the meniscus and how it's the shock absorber, it makes total sense that, you know, when you're up in the air, coming down with the rebound, come down onto the ground and, you know, your knee kind of just, gets jarred in a certain way, you know, that's where you see, you know, those tears, I guess, you know, inside the knee, whether it's the meniscus or, you know, ACL, PCL, any of that.
Right. Yeah, and I think it's important to highlight as well that, you know, although with a younger demographic of people like ourselves, you know, where meniscal tears are traumatic injuries that happens on one instance, there is such a thing as non-traumatic meniscal tears that happens more with the older population of people. And you know, it's just constant micro trauma over time that eventually causes a larger tear in which, you know, at some point they're going to have it tended to. So just an important thing to keep in mind. Not all meniscal tears are traumatic injuries. All right, cool. So Sean, tell me a little bit about what were you not able to do after that happened? Before, like in between the period of that happening and then us starting to work together, what sorts of things were you not able to do and how did you work around that?
I mean, it's tough to say what I wasn't able to do because I tried to do a lot of things with it. But, you know, just, you know, the regular day-to-day life kind of things where it's, you know, I would see a lot of pain, you know, and feel a lot of pain whenever I'd move, you know, laterally, you know, if I had to pivot on that, you know, on my right leg or, you know, move laterally or just even, you know, walking up the stairs, bending down to pick something up, you know, for example, you know, if we were golfing, you know, marking my ball, you know, on the green, you know, I would have to take a knee instead of squatting down to put the ball marker down just because it just was an immense amount of pain. You know, so it really just kind of hindered, you know, day-to-day life activities, you know, getting in and out of the car, you know, just caused a lot of pain and, you know, there's a certain amount of, you know, pain threshold that you have and, you know, that you could take. And it was just getting to the point where it was just naggy and it was just that we needed to do something about it. So, you know, when it started to really affect, you know, the quality of life that I was having, you know, my enjoyment, you know, for being outside, you know, being able to do different things, being able to just run or even play basketball at the park, do whatever, you know, that's when I really realized that I needed to get this thing, you know, in check and, you know, get it fixed up.
And what about as far as like, because I, you know, obviously we were first acquainted at the gym where I coach. How were you were you doing legs at all? How were you doing your leg days?
Dude, I was literally just doing, you know, the regular old, you know, leg curls, leg extensions, you know, super light. And, you know, I was really, and this is really kind of against, you know, who I am as a person, but I was honestly afraid to challenge my legs. And, you know, that caused a lot of, you know, bad things to happen to my body, a lot of imbalance, you know, I was, you know, super top heavy, really scared to, you know, use my legs to, you know, their, you know, full potential, was not going underneath the squat bar, wasn't deadlifting, wasn't doing the things that I really needed to do to, you know, keep my body strong. And it caused a lot of imbalances in my body, you know, a lot of, you know, tightness in my legs, my hamstrings, my, you know, hip flexors, all the way down to my feet. Just everything was just super tight and, you know, not as coordinated as it should be because I wasn't taking care of it the way I should have because of that injury. You know, definitely was always in the back of my mind.
You know, I think that's so important to highlight because, just you saying that, like, I think it's safe to say that you were just avoiding any closed kinetic chain exercises, right?
Absolutely.
And if we think about the benefits of those exercises, our muscles and tendons, they respond to two different types of forces, right? Tensile and then compressive forces. And even with our bone health, our bones respond, Wolff's Law, right? Our bones respond to compression. They respond to weight bearing. That's how they grow. That's how they become stronger and less brittle. So, as the audience, you could probably imagine the kind of long-term effects that could have if you continue to train like that for a long period of time. So I guess now let's move on to, your first couple of days with me and our workouts. I have a few of them pulled up right now, and they very much look like rehab style workouts, right, that you would do at your normal PT clinic. But what do you think was the main reason why you were able to have some success?
I mean, just the fact of the matter of just, how hard I wanted to work to get it to, feel better. I wanted to avoid surgery at all costs. And I know that, just based on my basic knowledge of the human body, I know that, something like the knee, it becomes unstable when everything else is unstable. And if we were able to, start off, with the rehab style workouts and kind of really build around the knee, build up the quad, build up the hamstrings, build up everything around it, we have more of a solid base to work with, and kind of keep it a little more in check, and allow me to finally get to, the squatting and the deadlifting and, even just, single leg squats and stuff like that. It really benefited me to start slow, obviously start with those rehab workouts. I mean, even just, just the balance exercises and, building the stability around it, I really think, went a long way. So I think that starting small and kind of trusting the process allowed me to, see not only success, but rapid success. I really, I feel like in the past couple months, I made, significant strides, especially, as it comes to, the squat bar and, just, the form, everything, how deep I was able to get in those squats or even just, deadlifting. So I think that the success really came from, starting square one and staying true to the process and understanding that this isn't going to be fixed overnight.
Yeah. And, one thing that I specifically remember was our second or third day together, I brought you a research article, and it pretty much just outlined the roles of the meniscus and at what point in weight bearing knee flexion is the meniscus under the most amount of stress and most amount of compression. And the article said that the meniscus is under the most amount of compression when our knees are flexed at about 90 degrees. So, we started with, higher elevated squats to a box or to a target, whatever it might be. But, a big reason why I think you had a lot of success was we were able to integrate those weight bearing exercises, but being smart about what is the role of this damaged tissue and how can we kind of build it back up to the point where we can squat at 90 again.
Yeah, when you pulled that article out, that's how I knew you were the real deal. I was like, all right, he's going to get this knee in the right spot. I know.
So, for PTs out there who are listening, I think this is a huge piece to client success. You can write the best programs in the world, but unless, number one, you have their buy-in, and number two, they adhere to what you're telling them, your program doesn't mean shit. And I'll be the first to admit my program is not the best in the world. It's probably, very mediocre at best. But what I did do was make sure that Sean knew what specifically he needs to stay away from to start, and then how we're eventually going to get from A to Z.
Yeah, I think if I could add something to that, first and foremost, I wouldn't say it's mediocre at best. I wouldn't say that. Give yourself some credit, but
I didn't pay him to say that. I promise.
I think that the most important thing too, especially for, I mean, obviously you're speaking to the PTs. I'm going to talk to the patients, the clients that they're going to be dealing with. I think that the most important thing is to be able to have open dialogue about what's going on. I think that patients should never be scared to ask, why am I doing this? What is the benefit of this? Because, I talk your ear off when, I'm working in the gym, but I stop and ask you questions. Why is this beneficial to me? I think that, to include that in the program per se is very important, just for both people. You get more well-versed as you speak on, different topics, and your patients and clients are learning about their injuries and learning about their rehab and why they have to do things. So I think that a combination of your more than mediocre plan, as well as, the open dialogue, really kind of expedited the whole process with, healing up my knee.
Cool. Yeah, man, I appreciate that. Thank you. Drew, anything to add?
Well, I have a question. So like, just because I don't know the full story, and I think you guys kind of both have like the inside scoop because you work together. But I think what you both said is you had a lot of trust between each other, which is huge.
For sure.
I know from that firsthand, if clients don't trust you, then you're shit out of luck, no matter how good your program is. But I think what people may not know is like, so Sean, when you first started, right, we did a good job. I think you guys did a great job of explaining like what you couldn't do, but like, where are you now? Like, what would you say that the difference is, and what kind of things are you doing compared to what you were able to do when you first started with Pete?
Yeah, I mean, dude, it kind of gives me chills to even hear that question, because I don't, I try not to reflect. I mean, I reflect a lot on, progress, but, especially in the gym, I expect to be at a certain level. So it's like when I finally got to that level, I felt, okay, I'm not impressed with myself because this is where I should be, because I was neglecting it for so long. So for example, we'll just start with just, a standard workout, squatting. First and foremost, I was never able to get to 90 degrees ever. And now, I could take, 350 pounds down, past 90 degrees. And I was never able to do that before my knee. Before we went through this whole rehab process. I'd be sitting there with, 225 on the bar and doing 3/4 squats and thinking that I was, a beast. And, I didn't start feeling like a beast until I really was getting below, parallel and, really moving the weight, properly. I would rely a lot on, my back strength and not as much my core, and wouldn't really focus on, my flexibility or range of motion. I kind of just went about my business thinking that, if I'm squatting, 225, that's good, I guess. And it's going to do whatever it needs to do for flexibility and mobility, when realistically it wasn't. It was honestly making everything worse, because it was just building up scar tissue in my legs, and it was just bad news all around. So I think, to answer your question, long story short, is just the movements that I can do now is, I feel like I'm like 21 again. I feel like I'm able to just do all these movements all over again. And, honestly, I feel like I'm where I need to be right now. So definitely think that, at the end of the day, if you're going through a rehab process, you got to look at, you got to look back and put it in perspective, so I appreciate, you asking that question, because I'm sitting here laughing at myself like, holy shit, I came a long way in the past 6 months. And, I think that, you really got to stop back and look at that,
And I'll chime in a little on that too. So yeah, like you said, he's squatting below parallel with over 300 pounds in the bar. He's deadlifting almost 300 pounds, doing hang cleans with almost 200 pounds, single leg squatting with external load past 90. Man, I remember doing the single leg deadlifts with no load and just watching that pelvis rotate, right?
Yeah.
So, just little things, right? Able to do some single leg RDLs without pelvic rotation. And, just there's a beautiful thing in simplicity, right? Being able to feel where specifically the exercise is supposed to target, right? Being able to feel the extensor chain, be able to feel quads firing with knee dominant exercises, right? Just came a long way for sure. I mean, from starting with standing TKEs and along our quads to where he is now, it's just absurd. It's absurd.
comes down to the explosiveness, man. I feel explosive again. You know, it's a good feeling.
Again, doing plyometrics again. I didn't even think about that. Yeah.
Yeah, you know,
I
it's
remember
a good feeling.
our so like, and you know, again, this is important to highlight, especially for PTs who are working in the sports performance field. Like, what we might see as plyometrics is not necessarily, you know, like, it's not plyometrics to these patients, right? I remember, again, like the meniscus is a shock absorber, right? So what literally I'm trying to think of what our first plyometric was, and it was like bunny hops, right? Just bunny hops in place. And then thinking about how we scaled it, it was probably 20 repetitions in total per session to start, right? Just very, very small. And then, you know, skipping in place, 15 repetitions per set per side. Like, literally the smallest effective dosage that you could possibly think of, and then just building off of that session by session.
Yeah, and I think that a lot of it too was, you know, starting small like that. And I like how you referred to it as doses, because with those small doses came more doses of confidence, you know, in the knee, in the legs, you know, just in, you know, athletic performance in general. You know, you go from, you know, playing sports your whole life to, you know, just lifting like you're bodybuilding for no reason, you know, for 5-6 years, you know, that puts a lot of wear and tear on your body. So I think that, you know, the small doses definitely help, you know, patients, you know, regain confidence. You know, I think that that's, you know, really big. Right there.
Any other questions that you have, Drew?
Yeah, just something to clarify. So like, I think it sounds like your improvements were range of motion, right? Like mobility. You feel like you can do things that you couldn't do before with some speed, feel stronger, right? Pete, my question's for you. What did the timeline look like? So you started out, you said, because there's kind of like, I'm getting some of it, but I don't have the full timeline. So like you started,
make it
you
clear.
said, where did you start? And then when did you introduce some of the plyos? And now it sounds like end game, you're doing more intense plyos and heavier lifts. So
That's a great question.
That's a great question. So we started in September, and we probably did 3 to 4 weeks of, you know, like your very typical rehab looking sessions of long arc quads and TKEs and squatting to a higher elevated surface with no load, doing single leg balance exercises, you know, doing like hip bridges and working literally proximal to distal, right? Throwing in some core work in there because obviously it's important to find that connection between upper and lower body. I would say we started with the lowest dosage of plyometrics after week 4. And again, it was bunny hops, it was skipping in place. And then, you know, the exercises really did not progress fast, but what did progress was the dosage. So, you know, like I have pulled up here one of his sessions from October, and
is October the beginning, like when you're doing some of the more like stable type low level exercises? Or?
Yeah. So if we started in September, you know, 3 or 4 weeks, that brought us into October. So that's when we really started doing more of the plyometrics. So like his dosage of his plyometrics was A skips 15 yards down and back 1 time.
That's crazy.
It's crazy, right?
Crazy.
1
It's
time.
nuts. It's crazy.
And listen, like truth be told, right? What's also important is constant checking in and constant feedback. There were days where he would text me, "Hey, dude, like, you know, day after lift, I'm at a 6 out of 10 right now. It doesn't feel great." All right, what do? We change the dose, right? And that's all it is. Not every program is going to be linear in progression. There's going to be ups, there's going to be downs, but if it's trending upward, then in order to make that happen, you have to have the right communication. You have to ask for feedback. And, you know, to Sean's point before, like, you have to, as a patient, you have to be willing and open and, ask for what you need, right? Have that dialogue, ask questions. If you think that you're annoying the shit out of your PT, you're probably not even asking enough questions, especially with someone like Sean, who he is very self-aware of his body, of his limitations, and he's curious, and that's one of the best patients to work with.
I have like a group question.
Okay.
I feel like the people who are listening to this, like, they're like, this is an awesome story and you got great results. Now, how do I do that with my clients? Right. So like, so what kind of things did you notice with Sean initially, like in your evaluation process, that led you to decide, like, here's where I'm going to start with him? And then the next question, this two-part question, would be, what kind of things are you seeing, or what are you looking for in order to decide that, okay, we're going to take a step forward and we're going to start with some plyometrics now?
Yeah. So I did not do a formal movement screen with Sean. I did a basic range of motion assessment. I did a really quick, like, manual resistant MMT with him. But for the most part, like, and we played golf together prior to all of this. So we did have a relationship prior to all of this happening. So, I suppose that's a bit of a caveat to the story.
Yeah, but it doesn't have to be like a formal assessment. Like, you could be like Sean was telling me, I felt this imbalance here, you know what I mean? And like, it could be something as simple as that. And because
Sure.
I think the coach, you're like, okay, there's definitely something going on here. Like, what kind of things did you notice, I guess?
Well, Sean is a pure rotational athlete, meaning he excelled in baseball. He played Division I baseball, and then he plays golf now, right? So all of his rotation is to the left, to the left. So, one thing that we certainly noticed is that sort of imbalance in trunk rotation, in trunk strength, and just his hips, right? He did have really poor hip mobility prior to this. Did not put in a lot of work in his mobility, in his pre-workout, routine, so to speak. And it showed, right? Like, just taking him through a warm-up was an assessment in itself. Can you frog squat? Can you bend over and touch your toes? Can you do a spider lunge?
So you started with like a lot of hip mobility stuff, things like that. So
Yeah,
we're working mobility around the knee.
Right. So, I mean, if you think about it, right, like, if you don't want 90 degrees of knee flexion, but you want him to get certain ranges of motion, like, where does that have to come from? We have to look at the ankles. We have to look at dorsiflexion. We have to look at the hips. I remember looking at his anteversion and retroversion of each hip. Like, for me, there are two ways that you can tackle an injury. You can do adaptation, where you promote adaptations to that specific area of injury, or you do substitution, where you work on other areas around that spot. And for Sean, and for anyone really, it's a matter of a balance between those two. Yes, we want to do adaptations to that area to make it stronger and build his confidence. But also, let's be honest, that meniscal tear is not going to go anywhere. It's not like it's going to, magically heal overnight. That's not how the body works. And with some tissues it is, but with meniscus, it's really not likely. So, for me, I think a lot of what we're doing is a good, healthy balance between adaptation and substitution. And for me, dorsiflexion and hip mobility were two big rocks that I wanted to make sure I tackled moving forward in his program.
Nice. Like, Sean, did you, when you were going through some of this initial, like, first stage stuff, working on mobility, what kind of changes did you notice?
I mean, dude, just getting out of bed in the morning was easier. Just this day to day. It's crazy to say this because I'm 27 years old. You shouldn't be thinking this when you're 27, but just day to day activities. I really neglected my lower body. This injury really made me neglect it, and it comes down to the mobility aspect of it. And you could even tell just by the way I was walking. I would lean forward, my hip flexors are super tight and all that. So I think that the progress that I saw was in just day-to-day activities. And then once I saw the day-to-day activities getting better, and easier, just moving around, gave me more confidence to go into the gym and continue working and making strides, to eventually be able to, get under the squat bar again, start deadlifting again. So I think that, when you look at, the whole process as a whole, and you make these little strides in just day-to-day activities, and you're feeling better just in day-to-day life, it definitely builds your confidence to go into the gym and say, okay, what's next? How are we going to get better than yesterday? Obviously Pete mentioned, I think communication's, a really big thing. I don't hold back. If I'm in pain, I'm going to work out through the pain, because I know that it's, at the end of the day, your knee or whatever injury you're dealing with, through PT, you're going to have days where it doesn't feel good, because you're dealing with an injury. But I think that, it's the little things, that you see, the little progress that you see throughout your day-to-day life is really, the most beneficial thing.
And I want to use that to segue to answer your second question, Drew. How do you progress your plan of care, right? How do you progress your treatments? And if anything, for PTs that are listening, this is the most important thing that I want you to take from this episode, is that there is no protocol of progressions. There's not. What it is, it's you doing what you think is safe and effective for the patient, and then you asking them, how does this feel? What did it feel like the next day? Are you in any pain? And just having that communication. I know that our sessions were effective when the quality was perfect, if he had no pain doing them, and then if he had your normal soreness the next day. Not pain in the knee, not a sharp pain, not like something that should not be there, but just normal muscle soreness that we normally get when we work out. And I think one thing that physical therapists do not do is test those boundaries. Listen, if you have a day where you follow up with the patient 24 hours later and they say, yeah, it hurts today, good. Now you know that was too much. Like, you need to have that. You need to set that boundary. And I made it very clear to Sean, like, listen, if there are days where you wake up and you're like, yeah, that was too much, like, you got to tell me so I know. Like,
I remember there would be days where you would have to stop me from pushing myself more, because I was trying to push the boundaries. So I think that's a good point that you make. And, I think that it is important to really, test those boundaries, because a lot of it too, I've said this a lot, throughout the past 30 minutes, is a lot of it comes down to just the confidence in the injury. When somebody injures something, you tend to, make altercations to how you even just move around. So, building that confidence up and really testing the boundary, I think is, an important thing for sure. Because there were days where I was, hurting, but I knew that, there was light at the end of the tunnel, I guess.
And I think specifically too, especially with the demographic that we're working in right now, young sports performance, maybe some older guys as well. I guess I would consider us older, right? But if you treat a patient, or if you're working with an athlete with an injury, and the next day they're like, yeah, I'm at an 8 out of 10 right now, it hurts, I think we overdid it yesterday, you're not making that injury any worse. Honestly, you're not making it any worse. You're not making that tear any worse. What would make it worse is if you had them go back to playing their sport before they are ready. Does that make sense? Like, the likelihood of you making that injury worse within your session is very, very small, unless you're just doing bonehead things. But, like, it's very small.
So I got two things.
Let's go.
All right.
Look at them smiling. They're going to be good things,
I know,
too.
they're going to be good.
Think about this one for a while. So first one, it sounds like your initial plan of attack was like, let's give this guy more room to work with, right? Like, because Sean, you said you had no like lower body movement capabilities at all. Like
Terrible.
didn't even know what it felt like to get like real hip extension. Like you probably didn't know what it felt like. I think you said a forward bend, Pete, like to actually like flex your spine and like you use the right strategies to do that. And so like what I think of when I'm deciding this is what I want to do with someone is like, all right, their circle is really small. Like this is their range of motion circle.
Mm-hmm.
So they have no idea like where the middle of the circle is, because it's hard to find the middle of the circle that's really, really small, right? So all you're trying to do is give the guy a bigger circle, right? And so I think that was what you were trying to do maybe in the first 3-4 weeks, Pete. And so a lot of times if you're starting like on one side of the circle, which Sean, it sounded like you were really shoved forward with like an anterior tilt, like standing on your toes type of thing. You can correct me if I'm wrong. But Pete, I mean, from your perspective, it's like, all right, let's use some more, and at least I would think this, like, let's use some more stability. Like, let's lie on the ground. Let's work on finding your hamstrings and your heels and get some real hip extension. Let's work on trying to drive some flexion and reverse the curve of the spine that's really shoved forward. So like, you know, if someone is shoved forward really far, you have to give them more in the other direction to make the circle even and make that circle bigger. Because if you're all in one direction, then that's how you get injured. And so, I mean, that was my first thing. Pete, I know you want to say something. Go ahead.
Yeah, go ahead, Pete. I want to mention something on that too. I thought that was a really good way to put it.
Yeah, I love the circle thing. So yeah. What it immediately made me think of was our 3 cardinal planes of motion, right? So yes, Sean, his pelvis was always on an anterior tilt. Always, always, always. Had difficulty engaging his extensor chain. And yes, his circle was very small. So the way I approached that without really thinking about the circle was going back to the basics. What are our 3 cardinal planes of motion? Sagittal, frontal, transverse, right? If I can get him better at all 3 of those planes of motion, then his circle is going to get bigger. So I think that was inadvertently, that's what I did, just not bringing it back to that circle analogy that you just brought up. But I think that's important with any injury that you have or any person in front of you, right? Like, yes, our knee is only meant to flex and extend. Is there a little bit of rotation? Yeah, there's tibial rotation, there's femoral rotation. Yes, there is that. Is it a main plane of motion that the knee does? No. But what if we think about the hip and the ankle, right? Like the ankle does inversion and eversion, right? The hip does internal and external rotation, abduction and adduction, right? So all of these things are tied together. So yes, if you tackle those 3 cardinal planes of motion, that is a good place to start to make that circle bigger. Go ahead, Chuck.
Well, I mean, both of exactly what you guys just said. Like, I'm not even in your field. I'm just learning from you guys as we go. And, you know, I love the fact that Drew mentioned, like, using more leverage, like using the ground to find your hamstring, find your heel, find this. I think that for me, throughout this whole process, the most important thing was finding that mind to body connection and being able to fire these things when you need to fire them. And so I like how you brought up finding the hamstring, finding the heel, and, you know, being able to drive, certain muscles to do what they're supposed to do when you're doing specific lifts or doing specific movements. I think that, you know, that was just an awesome way to put it. And the whole circle thing, you know, from somebody who's not in you guys' field, you know, it makes it a whole lot clearer, you know, for me to learn and for me to ask questions. And, you know, I think that, you know, the back and forth dialogue is, you know, obviously the movements and the workouts are important, but it's really important, I think, for, you know, you to be paired up with somebody who's, you know, well-versed and could, you know, explain things to you. I think that to me is like the biggest thing. I think that was, you know, that whole little segment right there was awesome. I learned a lot just sitting here listening to you guys go back and forth on that.
All right, Drew, where'd you get the circle analogy from?
I got that from Gary Ward. That was, the Finding Center. That was Gary.
Oh, okay, cool. Did you have another question too? I thought you had 2.
It was kind of a question. But I'm going to start with what I was saying before. So I'm going to that thought. So like, all right, so you're getting the circle bigger. Okay. I think of this as like now you can move in more directions, kind of what you said, Pete. Like you have more room to play with, so you're not afraid to go in a certain direction, right? And that's what you were talking about, Sean, is like you didn't have the confidence to go down as low, but that's because you couldn't go as low, probably, right? So like now you know you can go as low. All right, let's go there. And then so I think what I'm getting at here is like, all right, now we can go there. Let's actually go there, right? So now we're stripping away, this is maybe 4 weeks in, and we're starting to strip away some of the stability, and we're progressing things because we feel like maybe things are starting to look better. We can engage the right muscles. We can get pressure where we want it. We can get the volume where we need it, right? And so now we're starting to come, maybe we're off our back and we're moving up, right? So we're decreasing stability a little bit. What were some exercises that you did to start to, because you said like multiple planes of motion, Pete, right?
Yeah.
Give me some of those, and then also give me some things that I guess bridge the gap between things with more stability and then are starting to get towards, I guess, end goal for you. It sounded like now, I mean, the exercise that I heard sounded like the least amount of stability was like a single leg squat, right?
Yeah.
And so I think my question is like, all right, we're going from a ton of stability on your back, because to me, that's probably the most you can have,
Sure.
you know, lying on the ground. And then we're all the way up on one leg. So what does that look like for you?
You know, it's just playing with different positions, right? So I know initially we started with a lot of isometrics. So we started with iso split squats. We started with iso lateral lunges. And, you know, to me, that's tackling two things at once, right? You have your mobility and your, you know, your training aspect to each of those. I'm trying to think, and I can look back if I need to, but you know, the program was pretty basic, right? Like we did different lunge variations, obviously starting with no weight, and we just incorporated different planes of motion with each day. You know, like, so I'll give an example, right? And I will say that I don't know necessarily if this stability component never went away. Sean, we had this talk, I believe earlier last week, where you know, I talked about how I set up your program and how I kind of draw up your day from A to Z. And you were surprised that I don't start with writing up the warm up. I start with writing up the meat and potatoes of the workout. And, you know, the purpose of that is so I can visually see, okay, this is what he needs. These are the prime movers of the day. So now I can go back to the warm-up. Okay, so what do we need to incorporate to make sure that he is fine-tuned and ready to go to tackle these big things? So, you know, if like, I remember we did some bowler lunges. You know, week 6 or week 7, we did some bowler lunges. So what does that involve, right? That involves sagittal and transverse plane motions. And you know, I would argue that involves all of them, right? You need a little adduction to cross that leg behind you. So, you know, the warm-ups are just, they add stability. Yeah, like on that warm-up of that day, we did supine double leg hip bridges with adduction squeezes, right? So like that's how, that for me, that's how I write my programs. You start with the main lifts, right? You start with the meat and potatoes, and then you work your way back, and you're like, okay, well, if that's what he needs, how can I get him there? You know, I remember we did, still one of my favorites is we did single leg RDLs with like an isometric abduction push into a wall. So you have a physio ball at the hip between your body and the wall. You're balancing on the outside leg. You're pushing hard into abduction, into the ball, into the wall, and then you're doing your single leg RDL. Right?
Yeah,
So,
I think, just to stop you real quick.
yeah, go ahead.
I think what you're saying is that humans have to move around. Like,
Very
I think
simply, yes.
is eventually you're going to have to get up off the ground and walk around. So you're starting with some slower, low-level isometrics in standing, right? Is that what you're saying? So like,
That's what we started with, yeah.
Yes, you're starting with some things just to try to hold positions with less stability, but maybe you're teaching the positions with more stability so they can find the right muscles in the right positions initially, and then you're just kind of like building off of that.
Yeah, yeah.
Cool.
Just with a lot more words.
Well, I mean, I just think, for whoever's listening, like, sometimes it can be tricky. Like someone has a knee injury and you're like, shit, like this dude can't do this X, Y, and Z. You know what I mean? What am I going to do? But he still has to move around. You know what I mean? So like, how are you going to re-educate that? I think is important. So,
I think that brings up another good point. And this is something that, to be honest with you, I really took away from my current clinical rotation. Working with people with severe neurological deficits, you're going to bring yourself down a rabbit hole if you only think about what they cannot do. Think about what they can do. Do the things that they can do, and then go from there. Because you'll find a little bit of overlap. You will. And then you'll find a point where you can start to incorporate things that previously they were not able to do, but now they can because of the substitution principle that I brought up before.
Cool. So that's awesome. What are some substitutions that he needed?
So he needed the ability to hip hinge, right? The ability to go into controlled eccentric hip flexion and then go into a forceful active hip extension, right? Getting that pelvic rotation, being able to fire his extensor chain. And then just not relying so much on his passive structures to do things, right? So I feel like I've been talking about this a lot recently, but we have two different types of structures in our bodies. We have active structures and we have passive structures. Passive structures are ligaments and bones, things that we cannot voluntarily control. Active structures are our muscles and tendons, in which we have voluntary control over. So if you have damage to a passive structure and it's not going to heal, what do you have to do to substitute? Work on the active structures, right? The meniscus, that is a passive structure. That is not something that we can voluntarily control. So what we can do is increase stability actively. So driving more eccentric control of quads and hamstrings, driving more control of proximal hip and trunk musculature. Like that, does that answer your question? That's kind of what I mean by substitution.
I think that was awesome. I think what you're saying, it makes perfect sense. I think that was awesome.
Cool. Anything else, Sean, that you want to add to that segment before we?
Yeah, I mean, there is something that came to mind just hearing you guys go back and forth, because again, this is your realm. I'm the one that's sitting here. I'm learning from you guys. Me, dude. I'm always listening. I'm always trying to learn.
I see the pen in your hand.
Yeah, something for me that I think is important for not only you guys, as PTs to know, but from the client patient perspective, I think that what I learned is the most important thing in this whole process is the activation of these muscles before you go and do the movements. I feel like for me, going through these dynamic warm-ups and being able to, with my mind, say, okay, I need to be firing, my glutes on this. I need to be firing my hamstrings. I need to be doing this. I need to be doing that. I need to be keep my, my core, braced and tight and all that. I feel like going through these dynamic warm-ups, it taught me a lot about the mind to muscle connection that you really need. And priming them and making sure they're activated before going into these lifts. Before my meniscus tear, I would just go into the gym and I'd warm up with squats. I wouldn't do anything that would activate anything. So, it's funny because as I talk to you guys and learn more, even, Drew's been asking, he's been firing off questions left and right. And, I think that that's awesome. I think that it's important to learn how the body really is meant to work. It's like trying to go outside and, mow the lawn without priming the lawnmower. It's never going to work. It won't turn. You can't just go out to the lawnmower and just turn it on, and pull the cord. You got to, prime it. You got to do all these things to make sure that it's going to work, efficiently and optimally. So I think that just from a patient perspective, I felt like you guys would appreciate hearing the fact that it's not just about, the progress and where I am. It's the fact that I've learned a lot about my body and what's important to make it work and make it last. So I felt like I should throw that out there just, for you guys, to know that, you guys will have clients that obviously don't care as much to learn stuff about that, but you'll definitely have, especially if you guys stick, with athletes and people who you could relate to more, you're going to have people who are going to value, the knowledge that you guys are bringing, not only to the workouts, but, to their brains and what they could do with that knowledge. So I wanted to throw that out there because I think that's really important, for you guys to hear.
Yeah, that was perfect. Thank you.
I got something on that, Pete. And you can tell me if you don't want to, but I feel like it might be cool to define like what we're trying to drive with a warm up. And so like for me, I think a lot of times, we're driving awareness to a particular muscle.
Yeah.
And that's what you're saying, Sean. So we're driving awareness to a particular muscle via the nervous system. That's a big thing. Mm-hmm. And then the other thing that I think we're trying to do is we're just trying to give you more movement options. So like we're trying to, again, make a bigger circle so that you can actually use more range of motion when you go to train with some load. And so a lot of times for me, the question is, how do I get my client to buy in to this warm up? Because a lot of times it's like, oh, I'm coming into the gym to lie on the ground, or I'm going to like flex my spine. That's so weird. Like I never want to flex my spine, right? Like I'm supposed to only have a straight spine. Mm-hmm. So like a lot of times what I'll do is I'll show someone where their squat's at, right? Like right when they come in, I'll have them squat and they like can't get down very low, right? And then I do a few drills on the ground, help them find some muscles, open up some range of motion, and then I have them squat again and they're like, holy shit, like I can squat way lower. You know what I mean? So a lot of times that's, I think, a good strategy to drive buy-in, but it's also a good way for you to allow your clients to understand why they're doing some of these things. And so hopefully they'll start to do them more often. You know what I mean? So, and Pete, if you want to touch on some of that too.
Yeah, I mean, I think you answered the question, right? Like, if someone's coming in and they're going to train, like, so number one, I set the expectation of what we're doing for the day, right? So like what's on the program for today is A, B, and C, right? In order to do A, we're going to start with, whatever it might be, right? That abduction isometric and RDL, or, supine hip bridges to find the extensor chain, whatever it might be, right? Like if we're doing cleans on that day, we'll do like the in and out squat jumps for a plyo so we can get the timing and coordination down of our footwork. So I think number one, I like to set the expectation of what we have for the day. And one thing that Sean has done really well in the past was ask me the day before, hey, what do we have for tomorrow? So I would send him the program so then he can see, okay, this is what we have for tomorrow. For him, it was more of like a mental thing, which I think is still very important. But that's kind of like how I start the session, setting the expectation, letting them know this is what we have for today, and then just explaining how we're going to get there. Right, we're not going to do a split jerk press by starting with split jerk presses, right? We need to address scapular rotation on the rib cage. We need to address trunk control and anti-extension with overhead movements, right? Engaging our shoulder girdle stabilizers. Like all of those things have to come before the movement. And that's one thing that drives me nuts, right? You cannot warm up with that movement to do that movement. It just doesn't make sense. It doesn't. So I think that's more or less where I start.
Awesome. No, I think that was good. I think a lot of the stuff that you're talking about too is like get your heart rate up, get your core temp up. You know what I mean?
Yeah.
Get your body in a position to actually move successfully before you load it heavy or do things with high velocity. Because that's when you can get injured. And I mean, what does that sound like? That sounds like you jumping onto the basketball court and jumping up in the air as high as you can right away and rolling,
It's stupid. It's literally, yeah.
It's like, why do we see these NBA guys warm up how they do?
Right.
A lot of times it's cool. Like I always think of Stephen Curry because he does some weird. Have you guys seen what he does in his warm-ups? Like he'll play like soccer with a guy. Yeah, he'll do a spin move and then a jump shot. And I think it's kind of what you're saying, Pete. Like he's just trying to like activate the CNS. Like he's getting himself excited. You know what I mean? He's getting himself in a situation where he can be more creative during competition. And I think that's a lot of the time for athletes, that can be a thing too. Like a lot of them get super, I would say, like black and white with their movement. And sometimes it comes down to like, all right, guys, we got 15 young guys and they're moping. Like, let's play a game with some of these guys. You know, let's get heart rate up. Let's play a game. Let's start slow and then slowly work it up so it's a little bit faster. Usually with warm-ups, one thing I've learned over the years being a coach is you want to start on the ground and you want to move towards standing, decreasing stability, and you also want to move from slow to fast. And so, you know, that way we're starting to, like I said before, we're starting on the ground so we have more stability. We can drive awareness to certain areas. We can also improve that size of the circle, so drive more range of motion. And then after that, we're working up towards standing, decreasing stability, making things a little bit more functional towards, if they're an athlete, a lot of times, I don't know what sports are played on the ground, wrestling maybe. But, you know, we're getting up to standing, decreasing stability, we're increasing speed. And then that's probably where we're going to start to do most of our lift because, you know, that's what we need in life. I think we're meant to walk, we're meant to move around, we're meant to jump, cut, sprint. So yeah, that's where I'm at.
I like that. Yeah, I think that's one thing I heard from the Just Fly Performance podcast where, you know, you're working with kids, right? Start with some games, right? Start with like some slam ball or like some foursquare, like just let them move around, right? Like I think, and I'm guilty of this, I'm probably the most guilty of this. I'm very rigid with how I think and how I want my warm-ups to look. And, you know, when you're working with kids, like, you know, with Sean, it might be a little different story. But
it depends on who it is, yeah.
For sure. But no, I do think that's a good point worth addressing.
You're not gonna throw someone with a meniscal tear right into playing foursquare. You know what I mean? Like right. First day.
I would have done it though.
You would have done it.
I would have done it. I just, you know, talking about this is just making me really think about where we started. And dude, I remember putting the little foam mat in between my knees and just doing, you know, quad extensions. And I remember starting with that. And I remember like the thought lasted for probably all of 15 seconds because then I really realized that I don't care about anything else other than getting my knee right. But I remember doing that. I'm like, dude, this is so basic. Like people are probably looking at me like, what, this kid's like, he looks athletic, he looks this, he looks at why the hell is he doing little things like that? And just, you know, in this conversation that we're having, especially in the past 10 minutes, you know, humans are meant to move around. And I was not moving around with my legs. I might have been walking, I might have, you know, ran around, I might have done this, but I was not doing the movements necessary to make sure that I had a foundation to, you know, go from slow to fast with less stability, exactly what you were saying earlier. So I think that's just really important to address.
It's like anytime there's an injury, it's like a big event. It's like a 9/11 size event. You know what I mean, in the body, and you have to try to provide things that are going to be equivalent to that. I think in the opposite direction. Like so, Pete, you know, your job is to try to find things. In my head, at least, it's like to try to find things that are going to stick too. And that's always a big question for me. It's like, you know, how can we find things that stick that are going to drive some of the things that we've decided are super important for him during the rehab process? You know what I mean? And a lot of times it comes down to initially, I think, starting very slow with more stable surfaces, like a bigger base of support. So you have a larger center of gravity. So yeah, so like it's about trying to find things that are going to drive whatever you deem to be important.
And I think, you know, to go off of that, the sticking point that you just mentioned, in order to find what sticks, you have to find more about the individual that you're working with. You know, so I know Sean, he's very competitive and he wants to be a great golfer one day. So like, what is going to stick for him, right? Education on the golf swing and how our lower extremity is related to the golf swing. right? How your front leg has to receive all of that rotatory load as you go from pre-swing, the mid-swing, and then your follow-through, right? If you think about it, your front leg is receiving all of that load. You were bringing everything from back to front. So, that, and then how did I kind of address that? Well, we need to get you stable on both legs so that, number one, we're balanced, but number two, that front leg can have the capability to receive that load. So, one thing I love about Sean is that, like, so we started with a lot of like balancing exercises, right? Single leg stability, on our feet balancing exercises. And then, he would tell me, like, every day when I take a shower, I balance on one leg with my eyes closed. It's like,
I'd be brushing my teeth on one leg with my eyes closed. I was always trying to get better, dude.
So, talk about something sticking. Like, I can't think of a better example than that, right? But, like, how did I get there? I know him. I know his personality traits. I know how he ticks. So, you give him interventions that he can do on his own, that he doesn't need to come into the gym to utilize.
Yeah, I like what you said there. It's like, tell your clients why they're doing this stuff and relate it to what they're interested in and their goals.
And if you can't tell them why they're doing something, then you need to look back and see, why is it in your program in the first place?
Yeah, I mean, even in the past month, I mean, I'm not sure if you made Drew aware of this, but obviously I had that back injury that really I couldn't do anything about. It was caused by an airplane landing on a runway. What kind of luck is that? But even in the past month, what is so special about what you guys know and what you guys do in this field is you guys are aware of the body, not only your body, but other humans, and I think that, I think the most important thing is not only obviously make it like having, your clients, move around and do these movements, but making them aware of why they're doing it, I think is so, so important. I think that to me is the biggest thing, because you could tell somebody, to do something 100 times, and if they don't understand why they're doing it, there's no purpose for them, so that's why I, brush my teeth and, shower on one leg with my eyes closed, because I was like, okay, my balance sucks. I need to really work on this. And, especially with the back injury, we found a lot of flaws, in my core strength. And now it's like, I'm very cognizant of, I played 36 holes yesterday and I walked. And, there were times where I felt my back carrying my bag walking down the fairway. And then I'm like, oh, wait, I got to brace my core a little bit. And then the second I do it, I'd come upright and it took all the load off my back. So it's really cool to go about, the day-to-day activities outside of being in the gym and working out, and being aware of, exactly what you guys are there for, So I don't know. I think that it's really cool that you guys are just aware of that and make, not only you're not only aware of what you guys do for yourself, but you're aware, what's going to be beneficial to your clients.
Nice. Yeah, I think that's a good place to wrap up. The one prerequisite of being a coach is not your education. It's not where you come from. It's not who your experience is with. It's not what sport you used to play and at what fucking level. No one gives a shit. The one prerequisite that you need to have to be a good coach is to be a good person first and to care.
I agree.
Mic drop.
Now, when are we working out? I want to know that. I want to know when the three of us are getting after it.
Good question. Anything else that you guys want to add before we wrap this up? Concluding thoughts, comments, questions?
I mean, I just appreciated being on here. I could learn a lot from both of you guys. I pick your brain all the time, Pete, but last thing Drew wants is me asking him 1,000 questions.
We'll have you back on, don't worry.
I literally started doing this because I wanted to talk more about this stuff. Like, I don't have enough people to talk about it with, and I'm always looking for more. So, yeah, I'm an open book.
Yeah, dude. I mean, I think that for you and, your progression throughout your career, obviously, I think that it's awesome that you're willing to, open up like that. Cause I think that, you know, the reason why I asked Pete a lot of questions is not only for myself, but it's good for you guys too to get, you know, just well versed on it. So next time somebody asks you a question on, you know, a similar topic or the same topic, it's like, oh, dude, it just adds to your credibility. So, you know, I'll be reaching out to you. I send Pete a bunch of you know, things that I see on Instagram all the time, like, oh, what do you think about this movement? Oh, what do you think about this workout? So you'll be getting a couple of those, and, you know, I'll be picking your brain a little bit for sure.
You can follow, dude. I have a website. I just started an LLC, so I got a new company that I'm training some athletes with. And so, yeah, I do a lot of stuff on the internet. So I would
let's get after it then.
Yeah, I would love for it. But I gotta be honest, like what you're saying is so accurate because I used to not be able to talk like I can now. A big part of it was being forced to. At my last job, like I was forced to give in-services once a month. I was forced to present in front of hundreds of coaches once a year. You know what I mean? So like, and a lot of times it's being in the right room with the right people and being able to absorb some of that information and then kind of shoot it out to people like you. The biggest thing for me is like, I love that you're so open-minded because I think a lot of guys our age don't necessarily want to spend the time to talk about things like this. So I think it's cool to have someone like you, and I would love to talk anytime.
Yeah, man. I mean, part of that is you could think you're the best at everything, but there's somebody always better than you at something. You know what I mean? There's always somebody bigger and badder. So I think it's important to be open-minded because you can learn something from anybody, even if they're below you, you know, like even if, you know, for example, like, you know, I work in sales and, you know, I learn from everybody on my team, no matter where they are in their rankings. They could be, you know, underperforming or overperforming. And it's like, there's something that you could take from any single human being that you encounter with. And I think that's the beauty in you guys' work that, you know, kind of goes unnoticed. You know, there's so much information that you guys have stored up in your brain that you could literally help change people's lives. It's incredible. So we'll definitely be in touch for sure.
Good, yeah. So like, I want to say something on that. I'm like the last coach to be the guy who like posts everything about here's what not to do, you know, because I think everyone does that. It's like everyone's like, this method fucking sucks. Like this shit sucks. Like don't bend your knees. Bend your knees all the way over your toes. Like don't static stretch. Do static stretch. You know what I mean? It's like it's so fucking black and white, and like we don't know enough. Like we do not know enough. This is a brand new industry compared to most industries. We don't know enough to say like, don't ever do this or don't. So like whenever I see that, and this is just going to start our conversation about like what you see on Instagram. Like whenever you see shit like that, like blanket statements, like this is the best workout for your abs, or you know what I mean? There's not a best workout. There's not a thing that you shouldn't do. You know what I mean? Like who's to say like, don't move your body like this? You know what I mean? It's fucking stupid. You know, there's just better options for people because of the way that their structures are, you know, and that's the biggest thing to understand. I think coming from my last job is like, don't poo-poo shit unless you're a fucking doctor who literally has a client and you know for a fact they can't move in a certain way. You know what I mean? So like, poo-poo it for someone, but don't poo-poo it for everyone, I think.
Yeah, I mean, everybody's built differently. I mean, you take it, you know, I picked up golf, you know, a couple years ago, and it's like I was always asking people, oh, what should I do here? How should I swing here? And then I realized this was literally like probably, you know, over the fall/winter, I stopped asking people what I should do for my golf swing because no one's built like me. You know what I mean? We're all built differently. Somebody who's, you know, 5'10", you know, 215 pounds is going to swing a fucking golf club a lot different than somebody who's, you know, 6'4", 6'5", 200 pounds, way lankier. You know, there's different leverage, you know, systems that work. And, you know, so I'm always so open to just hearing what everybody else can, you know, has to say about, you know, different things. So I think that that's really, you know, important to not, like you say, poo-poo something just because, you know, it's not working for one person.